Turn the audio on. Right, brilliant. Thank you very much, Yvonne. That's lovely. And I'm really delighted to be joining this webinar. And apologies, I'm slightly, I've come into it just as many of you will be doing. You know, we're all busy trying to get everything sorted. And I've just been taking my mum to a hospital appointment, and she's currently living in a retirement village. So as I was coming back through with her, I was noticing all the fantastic opportunities for engagement and activity that were going on here. So I'm delighted to sort of be in the space where many of these activities that we're talking about should be happening. So I'm just going to tell you a little bit about myself and the National Care Forum, and then I'm going to go on to talk about some of the collaborative work that's possible, but also to focus a little bit on some of the work NCF have been doing around the falls prevention agenda and how this ties in very strongly with the work that Motortech and activity. So National Care Forum are not-for-profit membership organisation. So we work with those care providers who have been constituted in a way that makes them not-for-profit, so charities, housing associations, local authority trading companies, etc. So we work with all of those different providers across all settings, so care homes, care at home, supported living services, day centres, etc. So the full range of things, but all under that not-for-profit. And we, you know, within that not-for-profit sector, huge amounts of care provided to individuals across the country, loads of different types of services, lots of people supported within care homes themselves, and many of those fantastic staff and volunteers who provide great support. So the next slide, please, if I can, or can I do that myself? Perfect. I see, and I can see the buttons now, so I can do that myself too. So I just, as I said, I wanted to talk a little bit about falls prevention work, just because it's an area that we've been very engaged with, and it's a good example, I think, of that very collaborative work that can happen across sector and is happening across the sector at all sorts of different levels. So we're part of something called the National Falls Prevention Coordinating Group, which brings together a really wide range of people who are very interested in falls prevention and those who have falls within their remit. And it's got the NHS, the voluntary sector, social care, etc., and Public Health England, or now, I'm not sure which part of Public Health England it is now. It's probably in the health disparities and improvement side of things, host that. And they're looking at something that many of you might have heard about called the Enhanced Health in Care Homes model. Now, that is a framework that has been brought forward during the pandemic. It's something that's intended to bring a greater level of health care intervention into care homes themselves, and is also something that's really been very useful during the pandemic to have that kind of clinical oversight and supervision. So the intention is to move towards a much more proactive focus around healthcare in care homes, which is a good news. And what we're also looking to do is that care will be much more centred around the individual, the resident, their families and care home staff. And it's supposed to be whole system and collaborative in its essence. And what I think is really important for Motortech, for this webinar, for the work that you're all involved in doing, is that strength and balance is being recognised alongside falls prevention as one of those key priority areas. And there's a lot of support out there for people interested in this, and a digital platforms being created around that. Now, there is some great, so that's an example of some key guidance that people can have a look at. If you don't know about these resources that are out there, then do get access to them. But I think the triangle that's there shows the sort of core principles within it. So that fact that falls are not an inevitable part of ageing. And I think that's really important. And clearly, you know, we are delighted, as I'm sure all of you are, that the approach towards falls prevention is moved away from a kind of that very strong sort of risk-based approach, which essentially was about limiting the level of activities that people did in order to prevent falls happening. So there's a much more dynamic understanding of the importance of activity, the importance of engagement, but recognizing that there are things that can be done to reduce those risks of falls. And one of those is about building up the strength and balance within individuals. So there's a lot of great evidence out there around the impact that some fantastic physical exercise programs can deliver for individuals. And I think we're already seeing lots of that research and hearing about that. And I was really interested to hear the previous speaker talk about not just the physical impact of getting involved in some of these exercise programs, but also the mental stimulation and well-being that sat alongside that. And I suspect one of the things that we might want to explore and talk about is, how much a kind of health-orientated approach around falls, for example, might only pick up some of the physical attributes from of success around this, but actually we know that if you're more confident, if you have greater strength and balance, if you are less concerned about falling, then your ability to get engaged with the wider community is only going to be strengthened. And we're talking here about some of the programs that could be implemented, but aren't yet there. And of course, some of the difficulties that often care homes themselves might experience because of the location or the layout of their buildings, etc., that mean it's difficult to motivate people, which is why it's so exciting to have products like Motortech where that you've got the combination of the physical exercise with the mental stimulation that goes with it. And of course, from a social care point of view, our work is not just about people's physical health, it's about their mental well-being too. And of course, getting people to a position where they have that greater strength, greater balance, greater confidence in their own ability is likely to mean they have increased independence and a better mood. And I haven't got research slides here to show you, but I'm aware I work quite a bit globally with a number of different organisations through something called the Global Aging Network, and have spoken and we've held webinars with some Australian colleagues, which talk a lot about research that they've been engaged in Australia and in other countries around the globe, looking at the success and the measures around these strength-based programs and how transformatory they are in terms of people's expectations of recovery from, perhaps a fall, perhaps a stroke, or perhaps some kind of break and how absolutely building on a program which has the development of core strength, the development of core balance at its heart, can really transform our expectations and indeed the health service expectations of how quickly people can and how far people can recover. And finally, I just wanted to share with you one of our members' experience. So we have some fantastic members across the not-for-profit sector, and many of them are really interested in innovation, really interested in how they can change the narrative around the prioritisation of physical fitness and activity. And this is an example from one of those organisations called Belong, who ended up delivering for all their customers a personalised exercise programme. So this is really exciting. And again, I know this is one of the functionalities that are within the Motortech system, that ability to personalise this to people's individual needs. And that programme itself was coordinated around well-being, mobility, balance, and physical strength. And I think, the opportunity there for people to really look at the transformatory elements associated with a really well structured and dedicated program are seen in some of the examples here, getting people who hadn't been able to walk enabled to walk again. I mean, these are extraordinarily powerful things. Doctors had said, no, there's no chance of walking again. And yet, through that personalised exercise programme, through the skills and expertise of staff and encouragement of all care staff, individuals able to walk again within that setting, having exercise embedded as a fundamental part of customer care plans. And Belong is one example here. We have another member, WCS Care, who has outdoor going outdoors as a fundamental part of exercise plans of customer care plans, with exercise incorporated in that. And of course, to get to these places, there was a need for investment. So in Belong's case, they invested so that all of their villages and care settings had a gym built in with that specialist equipment aimed at frailer, older people. And we're talking about today, obviously, another key piece of equipment that's available for people. They had trained fitness instructors who could then work within multidisciplinary teams, who could bring together their expertise and knowledge with other specialists who might have had knowledge of neurodegenerative diseases and so forth. So they were bringing their exercise-led expertise into that broader multidisciplinary environment. They were doing some of those things that, again, I heard being talked about, those ideas of stimulating enjoyment, stimulating motivation, and getting people really engaged and looking forward to exercise as part of it. And, you know, we are not necessarily, I think it's changing, but we're not necessarily a culture of people who have had exercise at the heart of what they might have thought of as enjoyment. So some of this is about creating a different way of thinking about exercise, making it fun, making it part of care planning, making it part of the everyday for people. And I think care staff themselves, not those who were the specialist exercise trainers, but the rest of care staff were thinking, you know, this might not be something that gets very used. This might not be something that has a great appeal for people. Maybe we're going to make people feel uncomfortable or push them or whatever. But actually, the staff were converted almost immediately because they could see these kind of incredible results that were coming forward. And finally, you know, there is an aim to get to 100% of personalised exercise plans for all those residents. They're at 66% now. They're working towards that 100%. And it's that sort of whole system, so the whole organisation working together to bring forward exercise, strength and balance as a core part of their work. But even more importantly, that organisation working across the system, working with other experts, working with health systems and relatives and others within the system who could all sustain that focus and that important agenda around exercise, strength and balance as being key to people's maintaining and sustaining their independence. So that was all I wanted to say, and then I'm really happy to have a great discussion about it.